You're listening to the Fertility Docs Uncensored podcast, featuring insight on all things fertility from some of the top-rated doctors around America. Whether you're struggling to conceive or just planning for your future family, we're here to guide you every step of the way.
Welcome to Fertility Docs Uncensored. This is Dr. Carrie Bedient from the Fertility Center of Las Vegas. I am here with Dr. Susan Hudson of Texas Fertility Center and Dr. Abby Eblen of the Nashville Fertility Center. And we are joined today by our guest, Dr. Leah Kaye, who is one of my partners at Las Vegas. And we are very happy to have her today.
Thanks for having me.
Yay. So before we hit the record button, we were talking about, just where each of us did school, came from, and it sounds like, Leah, you went to college in a zoo.
Well, beside a zoo, technically speaking, but it had its own wildlife, I guess. It was its own little bubble. I went to Rhodes College in
zoo
Memphis.
Or the college had its own wildlife?
Oh, well, they kind of spilled into each other, I would say, at least on more crazy weekends for sure. But I went to school in Memphis at a little liberal arts school named Rhodes College. And so we were just talking about it because we have mutual friends with similar experiences. And the college happens to be located directly across the street from the Memphis Zoo. And so I was talking to some of the legends of people late night, early morning, sneaking across the road and not paying their zoo admission fees to see some of the wildlife up close. Never me, though. Never me.
A likely story. So would they you said that the walls were pretty tall and trying to get in. Were you part of the wall scaling crew and
No.
the roof jumpers, or?
Never that either, though I had plenty of friends who were more physically active and inclined than me. But the walls of this campus, like, it's a beautiful campus. It looks very Ivy League, even though it's a liberal arts school. And we kind of, as a result, we have a beef against sort of the true Ivy League schools. But it's a beautiful campus. And all of the walls are like the sandstone that are perfect for climbing, again, in the middle of the night when nobody else is paying attention. So if you didn't want to scale the brick wall across the street to get into the zoo, you could at least scale like the bell tower and get pretty far up before security was notified and got you back down.
Well, and we were talking a minute ago, Leah, about one of my anatomy lab partners who went to Rhodes College also. And when he moved into the college, he heard all these wild animal sounds, and he found out about 2 weeks later that he was actually really close to the monkey cages, and that's what he was hearing. And rumor has it may be urban legend, but rumor had it that actually some of the monkeys got out one time and got onto Rhodes campus. Is that right? Or
I've heard that as well. Who knows if it's an urban legend or not? It never happened in my time, luckily. But we've all heard those stories.
The question is, were the monkeys helped out, or did they just kind of, quote unquote, get out on their own because they were so clever? Or did some, brilliant junior and senior class liberate them to take a field trip?
I truly think some of these monkeys might have been a little bit smarter than some of the junior and senior classmates of mine. It was a really great school, a really, really, like, the smartest people that I've ever met, smartest people that I will ever work with. But we had a lot of fun in addition to doing a lot of hard work.
Work hard and play hard.
Mm-hmm. And I'll say one more animal story. The only thing is, we were talking about this that's funnier than the monkey story, I think, is when I got to residency at the University of Florida, they were talking about this lake called Lake Alice, and it was right on Fraternity and Sorority Row, and it was full of alligators. And I'm like, are you kidding me? Really? And that is the honest truth. I've seen the alligators. You just don't walk small dogs around Lake Alice in the middle of Fraternity and Sorority Row. So I think I'd rather have monkeys than alligators.
That makes me very nervous for rush week.
Yes, absolutely.
People who don't make it in get fed to the alligators. I mean, that's an extra penalty just for sorority and fraternity rushing. So talking about students, Leah is very active in all the educational programs that we have at the Fertility Center of Las Vegas, because there are multiple residency programs throughout town here, as well as medical schools. And so we hold appointments at University of Nevada, Las Vegas, as well as with the Mountain View residency program. And I think between the 3 docs here, all of us have either lectured, taught, had students rotate, residents rotate with us, fellows from the minimally invasive program. So we've got a fair number of learners coming here. And the patient response to that is always kind of interesting and a little bit unique when they're like, who is this other person? Like, I understand I came here to see you, Dr. Kaye, and who is this other person who's sitting in the corner of the room? So today we thought we'd talk a little bit about what learners are in this environment and really what that means for our patients.
Sure. So I think it makes sense, first of all, to kind of define what different types of learners there are in a given medical practice, especially like ours. And it's tricky because we use this term learners, but I know if you Google a picture of me, I don't look like I've been in school for the last 25 years, but I truly have. Like, there's so many steps to get to being an attending in medicine. And so when you think of a learner, they're not all at the same stage of their learning. So there are medical students. All of us went to medical school, and it's important to know that that's at 4 years after your bachelor's degree. And so medical students are not yet doctors, but that's your first kind of exposure to being in a clinical setting every day, all day. So you're not getting paid yet at that point. And in fact, you're still paying hundreds of thousands of dollars to be in that setting. But that's your kind of first exposure to patients on an everyday, all day basis. You show up like it's your job. You're there at 4:30 in the morning. You're there until 7 p.m. at night many times. And so that's kind of the earliest step that patients might run into learners. After we graduate from medical school, we enter residency. And so that's where we've chosen a certain specialty track. And for each of us, we've gone through an OBGYN residency, which means that we spent our first 4 years learning how to deliver babies, do gynecologic surgery, run clinics where many women are seeing us for their annual exams. And in residency, then it truly is a job. We are all doctors. When somebody introduces themselves as a resident, they are Dr. So-and-so. They're getting paid to be there, not nearly as much as we would need to survive comfortably, but we are getting paid to be there. And so that's residency. And for us, that was a 4-year period of time. After that, there are a number of residents who will go into fellowship. So that's yet another level of learning where you're not yet an attending doctor, but it's still a paid job that you're learning on the job and you're doing your training on the job. And so we all go through a fellowship specifically for fertility and reproductive endocrinology. And that for us is another 3 years after residency before we finally become attendings. And so in an office where you're seeing a doctor for fertility, you could be seeing a learner at any of those stages. And they have all come with various perspectives and various interests. A lot of time at FCLV, the learners you're going to see are primarily residents. So they are younger than me, men and women who are interested in OBGYN at the very least because that's what they're specializing in. Some of them are interested in subspecializing in infertility. Others might be interested in subspecializing in other parts of gynecology or high-risk OB. And so they are practitioners and physicians who are training to help you out at some point, whether it's at this beginning stage where you're trying to get pregnant or at a later stage when you're in your pregnancy, or as a generalist seeing you throughout your reproductive years and through menopause. So you'll see a whole bunch of learners from all different places with all different kinds of interests. And I think it's important, first of all, to just clarify kind of what those possibilities are. When asked kind of the general question, like, is it a good thing to have learners in your office? Hands down, the answer is yes. And I'll tell you why I think that's the case for a number of reasons. The first reason I think, and it's the reason that I think is most important and closest to my heart as well, is that you could kind of teach anybody to read textbooks and to take tests and to pass tests. You could teach anybody the testing, the diagnosis, like how do you recognize this? How do you treat that? And we can all go to UpToDate online and read like the content of what we're supposed to learn in medical school and in residency. But the part that you can't get from textbooks is watching your colleagues do what they do best, which is to work with people. That's the job that we went into. That's the business we're in, is not how do I read this textbook chapter to my patients, but how do I teach you? How do I explain this treatment to you? How do I provide a shoulder for you to cry on when I have to give you bad news? And those are the things that we as learners, all of us learn from our models, from the other people that we're around. And so for me, I think it's really important that the people in Las Vegas are getting to learn from some of the best teachers that are available, not the people who can give them the most reliable textbook, but rather the people that are going to show them this is what it looks like to have good bedside manner. This is what it looks like to work with a woman who is at the lowest point in her life and who is for the first time failing at something that she felt like she should have been able to do easily. And so for me, that's the most important reason to have learners in the office, because they need to be able to see and practice that humanistic part of medicine that they can't get in the classroom.
So, Leah, I have a question for you. What would you say to patients who are on the other side of the bed rail? Because we have learners in our office as well. And, you know, we always want to make sure our patients are comfortable when learners are present. And so we always ask them ahead of time, is it okay if this person comes in? And I think some patients are hesitant to say no. They don't want to hurt our feelings or hurt the learner's feelings. What would you just say to the patients that are on the other side in terms of, you know, why it's good for them to have that person there and I guess to kind of assure them that we're not there to kind of treat them as a laboratory specimen? What's
the benefit to the patient, not just the learner?
Absolutely. Well, I think one of the most important things, and the thing that I also tell my residents and my learners when they're first on our rotations, or when they're doing any kind of rotation that's a little bit more intimate like this, the benefit to the patient, I think, is you've got a very active listener who is probably infinitely more available than I am to them to do those other things that I can't necessarily do. So Dr. Bedient and I have full schedules in the office all the time. And it's very easy in fertility for offices to start to feel like they're churning out patients like numbers. And it's very common for patients to feel like a number when they come into our office, and the visits are quick and they go fast, and you're just get to the front of the line, get in, get out. One of the things that I think is great about having residents in our office is that they have nowhere else to be. They have nothing else they're supposed to be doing except to be there with you. And they're getting something from it. They're learning from that interaction. But at the same time, this is a chance for them to work on their bedside manner. And what I experienced when I was in training was that I was so much more available than my attendings that I started to develop really close bonds and relationships with some of those patients who needed a little bit more. They didn't want to just come in, you take your pants off, we probe you, you put your pants back on, you run. Like they have questions, they have concerns, they want to talk, they want to be able to spend a little bit more time with us. And we all wish that we could be that for everybody, but the reality in healthcare is that we just can't. The best thing I think about the learners as a resource to us is that they are there when we can't be, and they can be your first line of contact when you just need somebody to vent to, when you have a question that you feel like it might be too silly to ask your doctor. There's no question that's too silly. That's the honest truth. But sometimes having that learner in the room with you can kind of be like somebody else who can stay back a second, or who can read your expressions and say, I don't know if that exam went as well as the doctor might have thought it did. Let me just hang back and make sure she's okay. I felt like that was one of the best ways I could be useful when I was a learner. And so I try to tell my learners that that's one of the most important roles they can play as well.
Yeah. And sometimes what I've noticed too is because the learners spend more time with the patients and they take a history. I feel like I've done this for a while and I know how to take a fairly good fertility history, but it's really interesting how, coming from a different perspective, sometimes they'll ask questions that I don't think to ask, or they'll ask really specific things that I probably wouldn't have not thought to ask. So I think you get more information when you have somebody in the room that's doing an H&P that or physical that you wouldn't be doing, basically. What do you think, Susan?
I think it's great to have that other perspective, the other set of eyes and ears. I think there's things that people who are, closer in their formative, learning stages, that there are things that they may see that we may not see. And it's always great to have that additional perspective.
One thing that I've found is that a lot of our residents ask really good questions. And sometimes it's stuff that I know and can answer and give the textbook answer because it's such a frequent thing that we deal with. But sometimes it's something where I have to go back and say, okay, let's look that up. And in the process of looking it up, whether it's me looking it up, them or both of us, we pick up some random new tidbit because there's so much overlap. I mean, the human body is really elegant in how much overlap it has. So that 6 different cells that do 6 very different things all have the same structures. And you may realize, hey, that structure that we thought didn't have anything to do with what our favorite cells do, that may be really useful. And so sometimes, even though the patients don't really see it, just the presence of the residents or the students around makes us think harder, look deeper, make connections that we otherwise wouldn't have a reason to make.
I agree. They keep us on our toes and they hold us accountable to having them like most accurate and most recent and evidence-based medicine. It's really easy to kind of like get really settled into what you learned. But even for me, what I learned was 3, 4, 5, 6, 7 years ago. And fertility is such a rapidly changing technology. The treatments that we have changed just from when I first started. I'm not that far out. And so having learners around requires that we all stay on top of our game.
Well, and I think also too, the other perspective from the standpoint of learners is, nobody wants to feel like that they're having something done to them or somebody's talking to them that's new. But, we all in medicine, like you said, have had many, many years of training, and we couldn't be in the position that we're in right now if the same thing hadn't happened for us many years ago as well. And I think that also is in the nursing profession too. Sometimes, we have patients that get a little bit of pushback or give us a little bit of pushback if we have a new nurse that they're not familiar with. And, the reality of it is we like to keep our employees for a really long time, and we have a really good history of that. But there's always some turnover, and, everybody, whether it's a nurse or a new doctor, I mean, they have to sort of learn our system and learn how we do things. So it's really helpful when patients are willing to let them come in and be a part of our visit.
Mm-hmm.
Leah, have you ever tallied the number of tests that we've gone through by the time we get out at the end of all this?
If I did, I'd vomit in my mouth. No, you can't think about it that way or you'll never start.
That answer.
I don't want to discourage anybody from doing this. This is the best job in the world. But if they knew how many tests we had to take, nobody would ever get started.
And I will say it never ends. We continue to take tests. I even took one, I guess, about 6 years ago, but I had to retake because of my medical credits that I had to get. So it never ends.
Yeah. A hot item everywhere is, the value of standardized testing in schools, and whether, you believe it's valuable or not for your child. One perspective that I come from is that I feel that every major milestone I've had in my professional life, educational and professional life has, fortunately or unfortunately, there's been a standardized test of some sort that has been a gate that I've had to open up. And, there is a value in learning how to take these types of tests when you're younger, because I think if you didn't have that experience as a child, that once you got into college or medical school or further along in your training, we have some unbelievably complex tests that we have to take. And, it's harder as you get older to make all those neural connections. and so I definitely think there is some value in that.
Well, I'm hoping that the whole paradigm will shift in that I was signed up to take our subspecialty oral examinations at the end of April. And so what that is to become board certified in this subspecialty, you have to sit before a panel for 3 hours and kind of answer rapid fire questions about what do we do every day, about the research that we've completed in the past. It's a really big, really nerve-wracking, really expensive test. And
it's a really beautiful center where you take the test. You see where your money goes when you walk in the door.
Yeah, it doesn't make me feel good about it at all. But I have a little PTSD from the last time that I was there. And it's a test that we prepare for many, 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 many months in advance. And with COVID-19, my test has been postponed until who knows when. So I'm in a little bit of limbo, and I'm hoping that maybe this COVID-19 is going to be the paradigm shift that changes us from those oral exams to something a little bit more reasonable and less nerve-wracking. But
you'll just be telemedicine oral exams now.
I would just be happy to get rid of the MOC.
Right.
Yeah, by the time you rack up your ACTs or SATs, then the MCATs, and then step 1, step 2, step 2 CS, step 3 board exams that everybody takes, and then your individual board exams for OBs with both the written and the oral, and then for REI specialty exams, the written and oral, and then the maintenance of certification tests that we do every year, you just kind of get immune to it. I'm like, all right.
One thing to keep in mind is we are all obviously lifetime learners.
That's right. Absolutely
yes.
right.
Yes. So
yes.
Wonderful.
I wanted to ask you guys a question that's totally off of the topic of what we talked about before. But I had a question for you guys about, it's a common question that I get, and I want to know what your responses are. I think our patients like to feel connected with us as doctors. They look at us and we look a lot like them. And so it's the easy thing to do. And I'll have a lot of patients at the end of the visit that'll say, Dr. Kaye, do you have kids? And I'm always wondering, is anyone else having to answer this question? And if so, how are they answering it? And my answer might be different. I'll kind of save it for after I hear what you guys say.
Just the straight up question, do you have kids?
Yeah, like they want to know, they want a piece of your life to take home with them, How do you answer that question?
I actually have 2 children, but I also have them from IVF. So I kind of welcome that question because I can kind of tell them a little bit of my experience.
Yeah, I have 3 children, and my last child I did IVF. I include that, and people want to know, they do want to know part of your life. I mean, these people have just shared some of their most personal, intimate details that, that little bit of, delving into my life, I'm all for it. We've talked about, I practice in a relatively small city, and I run into my patients and I see them, and I see some of them at my kids' events, and so, it's just, we all want to form connections, and it's one of those things that I don't have tons of pictures of my family in my office. I have a couple of things kind of to the side and that type of thing. And so if people are interested in asking, I'm more than happy to share it, but it's not something that I'm kind of throwing out there per se.
And when people ask that, I tell people, yep, I've got 2 small little human beings at home and 1 fur baby. And I have a handful of pictures throughout my office, and a lot of people I find don't actually notice them because in part they're tucked away so that I can see them very clearly. But unless you're looking for them, you don't necessarily take them into the full view. But they're very much the foundation for why I do what I do. And so there's a part of me that's like, oh, I don't really want to rub into the fact that, you're here trying to have a family, and I have these 2 little people that I adore, who I think are just cute as buttons most days. But
and they are.
But yeah, I mean, that's very much the reason why I do what I do. Like, I get a lot of joy from my children and want my patients to have that too. So that's part of how it's personal for me to help them get pregnant, because I want them to be up in the middle of the night as well. And I want to not be the only one suffering getting kicked in the head every single night by my son, daughter, dog, or all 3.
Well, and I'll have to admit, I probably overshare more than the average person. And that's just kind of my personality. I enjoy hearing about them and their lives. And it's just amazing. Our patients are so interesting. I've had patients who are helicopter pilots, and patients who work for the CIA, and somebody that's a specialist in explosives for the Army. And it's just, I think our patients are just so interesting. I like to hear about their lives too.
I agree. I just got an email from a patient today who told me that they opening up a new brewery, a microbrew in town. And I was like, that's exactly the kind of patient that I need to keep in close touch with.
Well, I once had a chocolatier, so I'd have to top that with the chocolatier.
Oh, yes.
So what's the answer to the question?
Well, I tell them the truth, and the truth is that I'm allergic.
Allergic to children?
Not really. Yeah, I'm not actually, but I tell them, I don't yet, but I have eggs that are frozen. But I always wonder, is that like telling them too much? I start to wonder about myself, like, why are they asking? Do I have like a very clear void of a family in my office? Like, should I get pictures of someone else's kids and put them in here? Like,
I think your answer is perfect. I think your answer is perfect.
I was going to say, it does help them, like when we're talking about, especially when I'm explaining things like needles and giving yourself injections, it helps them to know that we've had to do it. And
Absolutely.
So we've seen the other side.
Absolutely. I think that's great that you share that. I think that makes them feel so much better when you share something like that, to shared experience.
I tell a lot of my patients that pretty much every REI physician, female REI physician that I know, by the time she got out of fellowship, she either had babies or had eggs frozen somewhere or embryos frozen somewhere, depending on where she was in her life. And to the extent that I know those details about the members of my class, it's very much true. Like we all either went in knowing you definitely wanted kids or you definitely didn't. And for everyone who did, they have figured out a way to try and secure that, because so many of us have been on the other side of that needle or want to avoid being on the other side of the needle.
Absolutely. So fingers crossed that those eggs will pan out for me one day. But I was just curious to know if other people get that question or if it's just me because they're trying to sniff out a psychopath.
No, I think it's a pretty common question, and it's one that I always welcome.
That and you fit in with our group because you're the same kind of crazy we are. All right. Well, thank you so much for hanging out with us, Leah. It is wonderful to see your shiny face on the Zoom and hear your voice on the podcast. I kind of got to admit, I miss seeing you around the office all the time now that we're all in quarantine and isolation and all of that. So everything's shut down. But this has been Fertility Docs Uncensored, and I'm joined here by Dr. Abby Eblen of the Nashville Fertility Center, Dr. Susan Hudson of Texas Fertility Center, and of course, my partner, Dr. Leah Kaye, and myself, Dr. Carrie Bedient of Fertility Center of Las Vegas. So have a wonderful day. Be safe, take care, and we'll be back soon.
Bye, everybody.
See ya.
Bye-bye.